Hi, this is Dr. Kathleen Hallinan, and we are continuing with our weight loss vlog. You guys are great. I have to say thank you so much for all your comments and kind words. That is what actually has encouraged me to continue doing this, that you've told me that this is helpful. So we're going to do another episode or talk today on Phentermine because, to be honest, that seems to be what a lot of people are interested in, and it's very effective. It works well, and I find I'm so disappointed that sometimes people have a difficult time finding a physician who is interested or willing to treat with this. To explain certainly their reluctance, it's important to understand that Phentermine is classified in the same category by the FDA as amphetamines, so this makes a lot of physicians wary of using it. However, when you talk to physicians who are well versed in weight loss management, you'll find that people who are experienced with it are very used to its use, monitoring for blood pressure and heart rate, monitoring for any other side effects. Really, the only other thing that I certainly have seen are sometimes people who maybe have an underlying anxiety disorder feel a little bit more anxious. But for the most part, actually, it really is even more subtle than people who are put on things like Ritalin for their ADHD. A similar concept. These are stimulants, but they do have interesting effects in your brain chemistry. So to go over just some other subtleties of Phentermine use. Okay, so here we go. So Phentermine, my board. Of course, again, monitor heart rate and blood pressure, which any responsible physician should be doing. And again, I caution you, please do not buy this stuff off the internet. Please get it through a reputable pharmacy. It just always makes me a little wary. Some of these mail order things, and people say that they got it from somewhere, but I mean, certainly, I guess if you have trouble finding it, but try to get it the normal way so you know that it is regulated and it is the right dose. Any physician who's managing you on Phentermine should be regularly checking your heart rate and blood pressure and should be monitoring you for success. And if you're not having success, should take you off of it. If you have somebody that's just prescribing it without monitoring it, then find someone else. Run, okay? So you should be having someone follow you appropriately. Should be done safely. So the next thing is, so these are some subtleties. Sometimes people have said, well, it works, or it didn't work, or taking it with or without food seems to make a big difference for some people. And so both in kind of turning on or turning off the effects a bit. So like, let's say you take it and you notice that it really isn't working as well, but you were taking it like with your breakfast. Take it before you eat breakfast and see if that doesn't augment the effects without giving you side effects of feeling either jittery or your blood pressure, heart rate going up. Conversely, let's say you took it and you were having success with it, but it made you feel too uppy, or it bumped your blood pressure or your heart rate. Certainly, at that point, I would cut the dose in half, but then the other thing I would consider doing is taking it with food to see if you can slow the absorption and see if you can get a little more even absorption into your system. So absolutely playing around with the with or without food component, you can use that to adjust both efficacy, so how well it works for you, as well as any side effects. The other thing that oftentimes I have people do is that if they're getting seemingly too much impact early in the day and then it's really trailing off at the end of the day, you can take that dose they were on and have them cut it in half and take, of course this only works with the tablets, not if you have capsules, so you can cut it in half and do half a dose in the morning, half dose in the afternoon, and then see if that gives you, again, a more steady state throughout the day so that you're getting a more even effect, so that you're not finding it 7 o'clock at night and now you want to binge eat or whatever. So, okay? So that's the dose in the afternoon part. Oh, here we go. So maintenance or off-label use. The FDA has approved only Phentermine all by itself for 3 months at a time. Again, I go back to was at an obesity conference and asked the director of a very large obesity center, you know, how long do they wait after the 3 months to start people back on the Phentermine, and he just kind of chuckled and said the next day. And just it's with the informed consent of the patient that this is off-label use, meaning in medicine, we often use medications outside of what is strictly approved by the FDA. This has to be done with some care and with some education to the patient, the person who is taking the medication, so that they realize. However, this is very common practice across the board, and so if the benefit outweighs the risk, and in this point, when you are dealing with people who are staring at risks of long-term diabetes, hypertension, risk of heart attack and stroke long-term, risk of peripheral vascular disease. These are things that are very real to people who are trying to manage their weight. Then the benefit to maintenance. So once you get to the weight that you want to be at, what can you do with your Phentermine? You can still take it every other day. You could take it only on weekends. I have people who take it and just have it around for when they know they're going to be on vacation, or if they know they're going out to something that they would be tempted to overeat at. So understand that you can absolutely use Phentermine on this as needed basis, and you can use it for past the 3 months, because when you lose this weight, you only want to do it once. You want to do it once and then stay there. You don't want to yo-yo, because generally every time you go back up, you'll go back up to a higher weight than you were before, and your body is constantly going to try to drive you to the highest weight you got to. So it is far better for you to discuss with your physician, whether this is an obesity boarded physician or your internist or family practitioner, the option of long-term, low-dose maintenance Phentermine treatment, okay? And then, so that's the last thing on my board. You still have to pick a diet and exercise if you're on Phentermine. I think most of you are doing very well with that, because I haven't really seen any comments about people who have tried Phentermine and said it really didn't do anything for them at all. So the people that I have had where that happened, they thought they could take the Phentermine and then keep eating exactly the same as what got them there in the first place. So I would tell you, make sure that you have picked a diet that you know will work for you and that you're still exercising. But certainly what Phentermine does is it increases your metabolic rate, and it makes you stop thinking about food, and it makes it much easier for people to adhere to a diet. So to adhere to the number of calories that they should be at. Okay, so I hope these are helpful. Your comments for me have been wonderful. I can't thank you enough. And so keep up the good work, guys. All right, thank you.